the North San Diego County Latino Book and Family Festival.
It's true, that's what I do. Oh man, the looks of it, you do too. Oh man, the looks of it, you do too. But what I gotta tell you, man, is being in Pachuco, doing the roles that I've been able to do has given me a sense of understanding of who I am, but it's given you an understanding of who you are. And Selena did the same thing. Mi Familia did the same thing. Stand and deliver blueberry from the water.
This here with all the ice on in the booth. At the gate outside, when they pull up, they get me loose. Yeah, jump out, boys. That's like you boys hopping out boost. If it's way too big, when we pull up, give me the loot. Don't play us for repeat.
Porque puede suceder.
Good morning, everyone. Bienvenidos. Buenos dias to today's panel for the virtual Latino Book and Family Festival. I am your host, Alina Gonzalez. A little bit about me, you guys have heard every week, is that I published my first book at 17. I went to college for undergrad in New York, recently received my MAT from USC, and I'm a big fan and have been so happy to be with you guys these last few weeks. Estamos muy emocionados que están con nosotros hoy este sábado en este evento virtual. Hoy tenemos unos unas personas muy importantes, muy especiales. Today we have a panel full of amazing people within the health industry. So that's a lot better than I can do for you guys. Even though I've seen all 16 seasons of Grey's Anatomy, I cannot give you as good of information as these panelists can do. So let's go ahead and introduce them. Ooh. If you guys can go ahead and take yourselves off video. Awesome, thank you. And I just lost your bios. Here we go. Sorry about that, you guys. So today we have with us Dr. James Cruz, Senior Medical Director of Blue Shield of California Promise Health Plan, Dr. Diane Chow, MD, Medical Director for Molina Healthcare, Monique Knight, Director, Marketing and Community Outreach for United Healthcare, Hermania Ledesma, Program Manager in the Health Promotion Center for Vista Community Clinic, George Gomez, True Care Outreach Specialist, and Lupita Hernandez, True Care Outreach Specialist. True Care was formerly North County Health Services. So the purpose of this forum is to provide information about health resources, opportunities the community should be aware of, and how to access them. For today's health forum, we invited a few representatives of health to share with us their health institutions and the resources they provide. El propósito de este foro es proveer información sobre recursos de salud, oportunidades que la comunidad necesita conocer y cómo acceder a estos recursos. Para el foro de salud de hoy, invitamos a varios representantes a compartir con nosotros sobre sus instituciones de salud y los recursos que proven. So first we have Dr. James Cruz. So let me pull up our presentation for you. And I'm having a hard time with my computer. I apologize, you guys. Okay. So Dr. James Cruz, take it away.
Thank you, Alina, and good morning, everyone. Blue Shield Promise Health Plan is most appreciative for the opportunity to share our commitment to providing the Latinx advocacy and empowerment in San Diego with you this morning. Next slide, please. Great, thank you. Yeah, as a health plan, Promise Health Plan offers the full range of services you expect in your health plan. You know, we have a network of high quality physicians, clinics, hospitals, and we provide a full range of case management services for women, children, adults with mental health concerns, as well as services related to social needs. But one thing I really want to highlight for you this morning is Promise Health Plan firmly believes that we must support community well-being and improve on an individual's access to healthcare by prioritizing the elimination of social inequities and partnering with community efforts to address social determinants of health. Next slide, please. So let me share with you a little bit how we focus on eliminating social and healthcare inequities. So one is our team establishes meaningful partnerships by working with the community to identify gaps of support, services, and resources. We then develop a framework to help fulfill the needed support and resources for the community. We also work closely with local government and community leaders. For example, I represent Promise Health Plan on the San Diego County Board of Supervisors Health Equity Subcommittee that's chaired by Supervisor Fletcher. And as part of the subcommittee's work, recently the Board of Supervisors adopted 4 key initiatives. The County Board of Supervisors adopted to provide $2 million of funding towards workers who have been impacted by COVID-19 and who need a financial bridge while they're waiting for their unemployment benefits to kick in. Also, the Board of Supervisors, as part of these initiatives, that they also adopted $24 million towards funding for rental assistance for these individuals, these workers that were impacted by COVID-19 and their families, to prevent them from being evicted from their rentals. The Board of Supervisors also recently adopted to fund $2 million towards bridging the digital divide. If you've seen in the news recently, some school children in Salinas, California, Monterey County, or in order to attend their classes, they had laptops that were provided by the school district, but what they did not have was the ability to afford internet connection. So these creative school children walked over to their local Taco Bell and were sitting on the curb in order to have access to Wi-Fi connection through Taco Bell. Well, this is part of what we need to bridge. That's part of the bridging the digital divide, where the Board of Supervisors is funding $2 million towards ensuring internet connectivity for low-income San Diego school children so they can access their classes remotely. Lastly, the Board of Supervisors is agreed to fund $2.5 million towards the improvement of information access for San Diego residents whose first language is one of the recognized threshold languages, so they can have the ability to access the needed information during this pandemic. We also support forums that provide a platform to address community needs, such as homelessness, domestic violence, health equity, distance learning, and trauma-informed care awareness. And this is how Blue Shield Promise Health Plan is leaning in to serve the Latinx immigrant community in San Diego. Next slide, please. So this wonderful photo is an example of an art resiliency project. We supported this project partnering with community-based organizations, and through our planned social services department, we were able to identify children in vulnerable communities that were able to participate in this art resiliency project. We've also supported San Diego in several other areas. We have sponsored multiple food distributions in North County, South Bay, and East County, where we've been able to reach out and touch over 1,500 families. We've established mini grants to community-based organizations that are providing behavioral health services in the schools for children who need behavioral health access across the county. We've also supported the distribution of school supplies and backpacks to hold the school supplies to over 8,000 low-income and homeless youth in San Diego County. And we're also convening community resiliency workshops to redefine resiliency as something to celebrate and to help eliminate the stigmata that happens when someone attempts to access mental health care. Slide 5, please. So, as I've said, Blue Shield as a health plan is committed to building an enduring framework promoting resiliency, dignity, health equity, and safe spaces, as well as healthcare access and services that you'd expect from your health plan. And as you see on the slide, here's for more information, please feel free to contact us. Last slide. So in closing, I really want to thank the sponsors of today's workshop, and Alina for inviting us to speak to you this morning, and thank you very much.
Thank you. Next, we have Molina Healthcare with Dr. Diane Chow. So,
Hi, Lena. Thank you for having me. And I am honored to be in the same panel group with Dr. James Cruz, who came from Molina and recruited me. So I'm so honored and humbled to present anything after him. A little background about myself. I'm a geriatrician, internist, hospice palliative physician. I've been in practice 25 years and am proud to represent Molina as the regional medical director for San Diego. I'm local in San Diego. So let's talk about a little Molina and what we do. I can't control the slides, so if you'll control it for me, Alina. So Molina, Healthcare of California, we've been around for 40 years. We are a government intermediary, and we serve about 572,000 members through Medi-Cal, Medicare, and Medicaid duals, covered California. Basically cover everything from physical to behavioral and long-term care services in the community. And I, as a geriatrician, practice in long-term care, post-acute care services for decades. So Molina Services, of course, the county that I represent includes not just San Diego, but also Imperial counties. And then there are other medical directors, Los Angeles, San Bernardino, Riverside, Sacramento, Orange County that we are in throughout California. Next slide. So what does Molina do? I mean, we provide access to all of our quality doctors and specialists and hospitals, very similar to other health plans, transportation services, prescribed services, lab, x-rays. We have a mobile app for you to access, and then prescription services and a 24-hour nurse advice line. And member services where you can contact through our website and call for enrollment. One of the things that impressed me so much about Molina when I was recruited to join by Dr. Cruz is really the transition of care coaches and our on-the-ground case managers. We're unique in having this emergency department support unit, the extended the breadth of members. Each one had their unique case managers. And I was, so impressed by that. And I've actually I'm overwhelmed every day by my team members, really, and the extensiveness of their knowledge and their experience. Next slide. So our management programs have weight control, smoking cessation, diabetes prevention, asthma programs, pregnancy programs, depression management, interpreters, educational newsletters, and beyond. But I can't tell you every day how each of my team members go above and beyond to support our community. And each of us have such many decades and years of experience. And this is at no cost to our members here. Next slide, please. During COVID-19, especially in the long-term care market, and what was happening in the nursing homes, I, as a geriatrician, seeing the cases, overseeing, the volumes of people who were admitted with COVID in our county, we were watching as people didn't have sufficient masks in our nursing homes that were really left off of a lot of the distribution of personal equipment. They were the last in line to get masks. We immediately started ordering antibody tests to help our skilled nursing facilities, donated over 27,000 face masks and N95 filter masks that are hospital grade to help protect our healthcare workers. And, they in those communities were so impacted by COVID in terms of nursing home outbreaks and the devastations that happened to our elderly seniors. And I, as a geriatrician, was just heartbroken to see it. We also have CBO outreach programs during this time. We contributed more than $275,000 to dozens of California-based organizations we call our CBO wellness campaigns, supporting individuals and families with food and personal hygiene items and other essential resources, as you can imagine. That because during this time, a lot of our members couldn't even get to the stores, and there was social distancing, and a lot of people who are frail, vulnerable, suddenly their ability to get to places, or people coming to them, especially in the initial days of closure, they were in isolation, and we were able to get out supplies to them. We also have member wellness campaign calls where we're reaching out to members just to check in and call to make sure that they have necessities during this challenging time. We're connected through our, on the ground forces, but also just phone calls and whatever way we can reach you. I think that's been the most impressive thing about what I've seen at Molina is our ability to deploy and the numbers of people that were in the field and efforts trying to reach our many members. Next slide, please. These are just images of the effectiveness of our team and in the field, and I myself, I am a geriatrician, and although I'm medical director of Molina, I immediately signed up to take hospital shifts and to really contribute on my part as a physician, because that's what I trained to do. So I just think that my colleagues were very similar. We went back to our clinical duties as much as possible while helping with the Molina. And our company fully supported our need to reach back to the community with the skills and abilities we were trained to do. So I'm always grateful to have been here at Molina during this time. We also, in terms of outreach beyond, the community, I myself serve on San Diego County's Whole Person Wellness. We have health homes projects. I sit on the board of directors for many organizations, including the 211, when you call on your phone, 211 advisory. I sit on that panel, as well as the American Geriatric Society. So, and our health information exchange in San Diego. Right now, this thing behind you, this virtual screen, I'm sitting in just my home, but this virtual screen is because some of the things that we lean in to do, I'm part of a presentation today that I'm going to be giving right after this one, California Long-Term Care Association, and this screen is what they provided me actually for that conference. But one of the things we do is we collaborate with the community in educational outreach. And this particular presentation I'm doing today right after this is really to help the nursing home community with standards of healthcare and to protect our members. And we collaborate with our knowledge expertise, but we collaborate with everyone and anyone that'll, have us collaborate with them really. But this particular screen, I thank them for, is really part of another presentation I have to get to, but I wanna thank Alana, and I want to thank those who are hosting this for inviting me to share. One more slide. Thank you very much to all of you. Thank you.
Thank you. I am going to turn this over to Monique Knight so that she can share her screen and tell us a little bit about United Healthcare.
Good morning, everybody. Let me pull up my screen for a moment here. Okay. Give me 1 second. Perfect. So good morning again. Thank you for having me. It's really great to be part of this esteemed panel. As mentioned, I am Monique Knight. I am the Director of Marketing and Community Relations for United Healthcare Community Plan. United Healthcare, like Molina and like Blue Shield, is a health insurance company. We provide various types of health insurance. So the type of insurance you would get through your workplace. We offer Medicare for the senior population and Medi-Cal for more of the low income population. And we call that program our community and state program. And that's really what I'm going to focus more on today. Again, our community and state Medi-Cal program serves low-income individuals and people who have either lost their health insurance through work because they find themselves unemployed at this time, or if their work doesn't offer health insurance to their employees. United Healthcare Community and State serves about 6.5 million people across the country. And the types of benefits that are covered through our Medi-Cal plan are, of course, a wide choice of doctors and specialists. We're contracted with a number of different providers and hospitals, including UCSD and Rady Children's. All of this coverage, so all of your doctor's visits, hospital care, prescription drugs, everything that Dr. Chow mentioned, it's all at no cost to our members. We also offer unlimited transportation services. So we will take you as many times as you need to and from your doctor's appointments, as well as to the pharmacy to pick up your medication. We also have a 24/7 nurse line. So you might find yourself either not feeling well or injured, and you're not quite sure whether you should go to the emergency room or make an appointment with your regular doctor, or if it's something that you can treat at home. Well, if you call our nurse line, we have nurses who can help direct you as to the type of care that you might need in your particular situation. And then, of course, all of our services are available in multiple languages. And then we offer a number of extra benefits for our members. So we have a number of different member rewards programs. Members can earn rewards for things like gift cards, for just undergoing their routine medical care. So getting health screenings and going to the doctor on a regular basis. We also offer a quarterly newsletter that we send to our members that includes all sorts of really good healthcare information. So tips on how to control blood pressure, healthy cooking articles. We include, fun recipes and things like that. And then we also offer live classes in the community. Again, these are all free of charge to our members, and they're really fun things like chair yoga, cooking demonstrations, and other health education topics. Some additional benefits that we offer are member meetings. So we are always striving to improve our services and programs, and we really want to get the feedback from our members. So several times per year, we invite our members to provide their input and feedback. And we usually hold the meetings over breakfast or lunch, depending on the time of day. And we also provide the members with a $25 gift card just for attending. We do other fun member events throughout the year to celebrate our members. We've done things like tailgate parties at the San Diego Sockers game. We've had free family bowling nights, just a number of different events to, again, celebrate our members. And we're always looking to support our community. So again, much like Blue Shield and Molina, we get very involved in our community. We want to know not only what are the health issues that our community is facing, but what are the social issues that are keeping you from being able to concentrate on your own health. And we partner with a number of different organizations to help address those concerns. For instance, we know that in San Diego, access to food is a really big challenge for a lot of people. So we put a lot of resources into funding and supporting local food distributions. So this photo here is just of one of our team members, Anna Lozano. Some of you may know her or have seen her in the community. And again, we're out there supporting the local food distributions. We also do other fun events like hold free community baby showers. And in fact, Armenia is going to speak later from Vista Community Clinic. We've done a number of community baby showers with Vista Community Clinic. And essentially, this is a really good way to support our pregnant moms, which we do a lot of. We have other programs, actually, our Baby Blocks program, where we reward pregnant mothers. They can earn gift cards and free baby care items just for going to the doctor and getting their routine checks throughout their pregnancy. And community support during COVID-19, of course, this has looked a little bit different, but we want to continue to support our community. One of the very first things that we did when COVID-19 hit San Diego is we started reaching out to our community partners, and we wanted to find out, what is it that our community needs from us at this time? We know that people have to be social distanced. They're not going out of their homes. So how can we help them? So we put together a COVID-19 resource list based on all of the information that we got back. And we were able to respond by donating about 16,000 face masks. These went to not only healthcare workers, but members of the community as well. We provided 400 face shields and over 1,000 hand sanitizers. We even donated 1,000 blankets to people who suddenly found themselves without a home because either they had lost their job or somehow their income level was affected and they found themselves living in their cars or other situations. And then, of course, during COVID, although access to food is always an issue in San Diego, it became even more important during COVID-19. So we put a lot of resources into funding and providing supplies for local food distributions. We delivered infant formula to new mothers and even had groceries delivered to our United Healthcare members who didn't have access during COVID-19 because they weren't able to leave their homes. So all of those efforts were local, so here in San Diego specifically. But across the country, United Healthcare has provided more than $80 million in support of COVID-19. So now that you know a little bit more about our Medi-Cal plan, I wanted to offer information on how to apply for Medi-Cal. If you think that you might qualify for Medi-Cal, there's a few different ways that you can apply. The first is you can go online to covercalifornia.com. The second is you can walk into any San Diego County office and ask to speak with someone and they'll help you. Or you can call the 1-800 number that's here on your screen. And what happens is once you apply and you've been approved for Medi-Cal, you'll get a packet in the mail with something that's called a choice form. And at that point, that's when you select a health plan. So United Healthcare will be one of the options on that choice form. So you can either fill out the form or you can call healthcare options at the number on the screen here. And then, of course, United Healthcare is always here to help. So if you have any questions about any of the plans that I mentioned, call us at 1-866-270-5785, or you can visit us online at uhccommunityplan.com. So thank you very much.
Thank you. Next, we are going to the Vista Community Clinic.
Hi, everyone. Thank you for having me. My name is Herminia Ledesma, and I'm an outreach and migrant health program manager for Vista Community Clinic. As some of you might know, we are located in North County, San Diego, and offer primary care services to the North County community, which I'll share with you about in just a second. Can we go to the next slide, please? Our mission and really what drives our community clinic efforts is making sure that everyone in the community can choose health. And we not only do that by ensuring that folks have access, but also by offering programs and services to really enhance folks' experience and ability to choose health. Next slide, please. We offer a variety of services, and I won't go into it because I really like to focus the presentation on our COVID efforts. But one of the things that we're so proud at the clinic to be able to offer are specialty care along with all of our primary care services. So as you can see here, we have acupuncture and we have chiropractic and we have, you know, behavioral health, mental health, really offering a comprehensive list of programs and services that we have available to folks. A lot of these specialty services, folks often don't know they're covered by Medi-Cal. And so if you all have any questions, we will be sharing our contact information, but we encourage you all to get connected with our clinic and see if there's a service or a program that we might be able to help you with. Next slide, please. We have already 8 locations, although one of them is our office, our administrative offices, but the ones I want to highlight, many folks are familiar with our Bell Terrace location, which has been our main location located in Vista, but we actually have 2 dedicated sites that are focused on specialty care to special populations. So our VCC Durian is a pediatric clinic ensuring that all kids in Vista and Oceanside have access to pediatric care and has a small practice feel. And our newest site, which is so new it's not even pictured here, is our VCC Mission Dental site, focused on providing services to family dental services in the city of Oceanside. Next slide, please. One of the things that really stands out for me and why I wanted to work for the clinic was all of our community health programs that supplement the services that we offer in the community and the primary care that we offer. We have under our community health programs, our HIV services, youth development, maternal child's health, and under each category, you can see some of the programs listed: migrant health and community engagement, clinical programs, women's health, North Coastal Prevention Coalition, and tobacco control program. One really important thing about all of our clinic services and our community health programs is that we're still offering most of these services in an adapted, safe way to ensure that all of our patients in our community have access to care and access to the resources that they need. So under our migrant health programs, we offer programs like Bridges to Health, which offers enrollment out in the community to our Oceanside residents. So you can visit us at Crown Heights or Chavez Resource Center in a partnership that we're hosting with the city of Oceanside. We also offer food distributions, diaper distributions, again, all in a safe way. So most of these programs do either require an appointment or require you to be screened to ensure that anyone that comes and accesses our services is healthy and stays healthy. We recently, which you'll hear more about, launched a COVID mobile testing unit, which we just started out to take out into the community. And so aside from folks being able to come into our clinic, which we still do have COVID testing in our clinics, we want to make sure that COVID testing is accessible to all of our communities. And we have events going on next week, which I'll share more information about. And what's neat about the mobile unit is that it's actually no cost and there's no requirements to get tested. Unlike other testing sites where they do ask about COVID positive exposure or symptoms, our COVID mobile unit testing really is working on ensuring access to COVID resources and testing all throughout the North County. Next slide, please. Here is where you can find our mobile unit this upcoming week. And we actually have one site missing. We actually will also be in the city of Fallbrook on the 14th. But on October 12th, we're partnering with our MAC partners to be at one of their sites. All of these testing sites happen from 9 a.m. to 4 p.m. And we additionally will be at other resource centers in Oceanside. So here's a little bit more information for anyone looking to get a test and have it be close to their where they live. And we have events, like I said, going on next week, and we'll continue these services throughout as long as the community needs the services. Next slide, please. And that's it for me. Thank you for letting me share, and we encourage you to call our clinic and get connected to resources. Thank you.
Thank you so much. Next, we have North County Health Services, or outreach team.
Hello, everyone. Good morning. My name is Jorge Gomez, and I'm with North County Health Services, now known as TrueCare. So I'm going to go ahead and get started with our name change. Many people are still unaware that we have changed our names. The importance of changing our name came from highlighting our care that we have for the community. It's true, we want to engage with the community and make sure that they receive the care that they want and that they do need. And we are also working with the confusion that sometimes our clinic would have for our community members. They would believe that we were associated with the county, and at some point they would be afraid of actually coming to our services. But what we want to emphasize is that we are a nonprofit organization. We work for the community and with the community in order to assure affordable and quality health care. Now, I want to get started with the measures that we're taking in order to be able to see patients and in order to be able to actually work with them during the times of COVID. So at the front door, it's going to be screened for temperature and for any symptoms that you might be having. And we are maintaining top cleanliness and making sure that everything continues to be sanitized for all of our patients. Currently, we are mostly seeing people by appointments. So if you would like to receive a service within us, we would very highly recommend an appointment. Could you go on to the next slide, please? So a little bit about us at TrueCare. We have 12 health centers throughout North County. We have 7 WIC offices and 5 dental offices here. And the important thing to know about us is that we offer medical, dental, women's health, behavioral health, pharmacy lab, and x-ray services. All these services are offered throughout all of our centers. And if one of our centers doesn't offer this, we will bring you to one of our other centers in order to actually have people meet that need or meet that service that they are requesting. Now, we have been around for 40 or more years in North County, and that was another thing that we wanted to do with our name change. We wanted to, since we now do have a health center in Riverside, and we didn't want to limit what the services we did and the communities that we were helping. So we decided to change the name of our health center due to that reason as well, due to expansion and due to the holistic view of what we were trying to do as a health center. Next slide, please. So I'm going to go ahead and get started with some of the adult services that we offer. So I'm going to go ahead and start with sick visits. Sick visits happen when you have an illness or an injury, or when you need a variety of testings and screenings. We offer those through appointments as well. But what we do want to emphasize as well is the importance of wellness visits. especially for our communities, our Latinx communities. Sometimes we only go to the doctor when we're sick, when we're injured, when something hurts. And what we want to emphasize is that we have these regular or wellness visits available for us, whether it be checkups, whether it be immunizations, whether it be physicals, or whether it's family planning. We want to make sure that everyone is able to prevent the sick visits, that they're able to prevent coming to us once they feel that they have a pain, once they have an illness. Something that we do want to mention as well, the wellness visits, we also offer at some occasions immigration naturalization services. These are done through our patient resource center, and those are on specific dates, and I can go ahead and get more information on that. But what we do want to encourage right now is the walk-in visits for our health centers specifically are not recommended at this time. We would greatly appreciate setting up an appointment instead of having to turn you for not having an appointment. But we do have very flexible schedules. We are also open on the weekends in order to help as many people as we can. Next slide, please. Now, for pediatric services, we would like to highlight also the well child and sick child exams, whether it be coming because your child is sick or coming because you just want routine checkups for your child, immunizations as well. And then we also do have resources for childhood obesity screenings and prevention and management. We do also offer dental care, not only for pediatric patients, but also for adult services. Now, one thing that we would like to highlight right now is that our dental services are currently open, and we do have a very minimal wait time. So if someone would like to seek dental care or dental treatments, right now would be a perfect time to call or to set up an appointment, since we could eventually have you be screened or seen within a week's time. And then we also do offer the sports and school physicals. Those at sometimes aren't covered by your insurance plans or by Medi-Cal, but we do offer low prices for those. I believe it's $25 for each or for one exam. Next slide, please. So for women's health, we are partnered with the Every Woman Counts program, which emphasizes free breast and cervical cancer exams for anyone over, so the qualifications for this program would be anyone over the age of 40 or who may have some symptom of breast or cervical cancer or anything that might not seem normal. Another limitation or restriction that we have on that is that they have to have minimal to no insurance. So it's meant for these people who may not have insurance plans, who may have insurance plans that don't cover these services. It's an aid to actually be able to come out and seek these services that are offered to our community members. Next slide, please. And so for behavioral health, we also want to emphasize the importance of that during these times of COVID. We want to emphasize that we do have these services running. They are adapted to some services are offered in person, others are offered via telehealth, but we are still currently offering these services. It could be individual care, it could be couple, or it could be family therapy. We do offer management skills, conflict resolutions, and if there is a service that we can't treat, or if there is something that we can't treat, we would be more than happy to refer you to actually receiving the help that you need with another outside provider. Next slide, please. So our additional services, we do offer X-ray services, blood works, and lab work. We have pharmacies in Oceanside at our Loma Alta location and here in our San Marcos location. Now, when it comes to additional services, we also want to talk about transportation. We are offering transportation to and from our clinics if you have an appointment through a partnership with Uber Health. Now, how this works is you would call our clinic and you would say that you have an appointment and that you would like transportation. Our call center would then provide you with messages from your Uber or from the car that's going to be picking you up when they arrive at your location. So then you can take this vehicle to our health centers. What we do ask is that when you're in the car, you wear your mask, you are keeping it on throughout the whole ride. And yes, so also we want to emphasize that during COVID-19, we have also maintained our help with the community. We host a food distribution every first and third Wednesday of the month in San Marcos, and every second and fourth Tuesday of the month in Oceanside. From the beginning of COVID, beginning March, once the lockdowns started, we have been serving approximately 500 families per food distribution, and we're more than happy to continue helping the community. And we want to emphasize that food insecurity is a big problem within our communities, and we want to do the best that we can in order to help them to have a meal on their table, to have fruits and vegetables and other dried goods. We would also like to thank everyone for doing what they're doing with COVID-19, and we would like to continue to tell people to continue wearing your face masks, to continue washing your hands, since it's one of the ways that we're going to help get over COVID-19 and to actually help to one day come back to a normal setting. Thank you.
I want to say thank you to everyone who has joined us. And if I can get you to go ahead and come off of your, show us your camera. I do have some questions that we would like to ask you, and feel free to answer however. How can we, so there are a lot of families that have babies at home. How can we protect babies during the pandemic and the upcoming flu season? And anyone is free to take this question.
Well, at United Healthcare, we are definitely encouraging everyone to prepare for the flu season. With COVID-19 in full swing and the flu season is really arriving now, everyone should get their flu vaccine. Babies ages 6 months and older should get a vaccine. Almost everyone 6 months and older should get a vaccine, unless you have underlying health conditions in which you should talk to your doctor to get clearance. But United Healthcare is partnering with Champions for Health, which is a great organization that provides free flu clinics. So United Healthcare and Champions for Health are partnering to bring over 130 free flu clinics into the community. They will be in front of your neighborhood grocery stores, community centers, schools. There's no insurance required, no cost. You can either drive up or walk up. And again, we're just encouraging everyone, that's really the best way to prepare for flu season, is to get the vaccine.
Well, Alina, if I could add to what Monique said, we have two excellent representatives from community clinics, Mr. Gomez and Ms. Ledesma. And both of them have very comprehensive pediatric care programs. And so one is, I'd recommend that if an audience member has a question and they're looking for a provider of pediatric care, I would recommend that they take a look at the contact information and reach out to have a discussion with their with one of the spokespersons at those community clinics. But also, to Monique's point, and both ourselves, Molina Healthcare, and I'm sure United Healthcare, we all have access lines 24 hours a day, 7 days a week. So if a member has a question about what should I do regarding my child, or have a question regarding a symptom that my child has, or we've possibly been in contact with someone with COVID-19, that's a good place to start in terms of getting a guidance on what might be the next steps.
Thank you. So we have another question. What are some ways that these companies are incorporating culturally relevant practices? So how can we connect to families that would rather seek out a sobador or a curandera versus a doctor?
Well, that's a good question. And I don't know if I have a good answer, but here's what we know. We know that we support and endorse, alternative care choices for members. That if they choose to seek the care from a Salvador or a curandera, certainly, we want to make sure that individuals are informed, educated on the various types of care, and perhaps what care is there's evidence on, in terms of treatments for certain conditions. I don't think we have a contact list of curanderas or salvadores in our health plan. But again, we want to be supportive of individuals seeking out, a variety of treatments for the care. We just want them to do it safely and from a well-informed basis.
I think you're
Elena,
on
you're
mute.
on mute.
There you go.
Thank you about that. I always forget that I mute myself or unmute myself. I am checking our Facebook to see if we have any other questions from our audience, but I want to thank you guys for your time and for being with us today and the wonderful resources that you have shared. We do have one last question. So with higher rates of diabetes and nutrition in our Latino community, are there food products that are marketed as healthy, specifically to Spanish-speaking community members, that would be better to avoid?
Well, you've got tough questions. And I have sat there silently as I watched Dr. Cruz take on all the tough questions. So I'm going to take a jab at this one. I'm not able to answer questions regarding grocery and food and what is marketed out to specifically Latino communities. But I can say that there are a lot of foods that have very high glycemic index, and sugar and carbohydrates and all those important things should be discussed with their providers. And so as a health plan medical director, I always defer questions because we're not clinicians in the field. We're overseeing care and the quality of care. So we, as Dr. Cruz mentioned before, we make sure that the care is evidence-based and of high quality, so that, when you're asking questions, whether it's about nutrition, diet, diabetes, that the answers that come back towards you are really directed towards your individual care needs, because there's different types of diabetes, right? So I don't want to address diabetes as if everyone has the same diabetes in that question. But if you're carbohydrate counting, or you're working with, your physician, your provider, those are things that you should be discussing with them directly. And, most of the community clinics have nutritionists, dietitians that can also work with you to help counsel you in the appropriate, amount of carbohydrates of food. And there's so many foods you can buy from anywhere that you might want to bring in that particular product to your doctor so they can take a look at it, or your nurse practitioner, your physician assistant, whoever you may be seeing care from, that to bring that particular product in.
Muted again. Awesome. Thank you so much for that answer.
And Dr. Child's absolutely right, and especially want to endorse reaching out to our colleagues at the North County, True Care and Vista Community Clinics, because of the expertise that they have there. But just in general, just for the audience, fresh is always better than canned, and certainly, processed foods, like the things that are in a packaged box or something like that, is definitely something to consider avoiding. And so I sort of said, like, the closer to the source, meaning the closer it is to the ground, or the more like it was when it just came off the tree or off the vine, or it's superior than something that's been changed, modified, processed. And do not be fooled by advertising that will say something, that's packaged to say, healthy. I'll give you an example. I was in a service station several months ago putting in gas, and I came upon a package of chicharrones, which, if you know what those are, the fried pork rinds, and it said 0 carbohydrates. Well, that's true. It's also pure fat, which is not good either. And so some, deceptive, but it's also, like I said, it's in a package, and fresh is always better than, packaged or processed. Frozen, if you don't have a choice, frozen is better than canned or processed also. So just a few little hints.
Awesome, thank you. We do have one last question from an audience member. How do we support families that are anti-vaxxers and help them stay safe and healthy?
Well, I'm a vaccine proponent. I'm a vaccine proponent. And in my former life, I was a speaker for vaccine companies. So I want to disclose that. But I would say that in general, vaccines work best via herd immunity, and especially in the flu season. And we're talking specifically, in this case, I'll give you an example of the flu. And so if we have people who are not vaccinating themselves, it really affects the entire herd. So what that means is, we would be at risk, and as a community, we're at greater risk when we have larger amounts of anti-vax. So, each person has to consider for themselves their risks, but I would say as a community, we are at increased risk because we're in the middle of a pandemic as well. So you're facing a winter season with COVID still there, as well as the flu. So if you make the personal choice to be anti-vax with the flu, imagine even if it did not improve your personal vaccination risk by removing it 100%, the community's risk at large, and why we social distance and why we wear masks, is really to affect those around us who are at high risk in our herd. And so being and choosing not to vaccinate may put those around you that you love at risk. So to think of it that way.
Yes. Thank you. I think that's a great way to look at it. I know Ana wants to take a moment just to translate into Spanish some of the key points that you guys have made during this presentation. So I'll pass this on.
Hey everyone, this is Ana. I've been working for the festival in Empowering Latino Futures. Gracias a todos por estar aquí. Thanks everybody for joining this health forum. I know you all share a little bit about some important pieces from your institution, health institutions, but para los que nos están escuchando en español, quiero introducir una vez más a los presentadores y decirles un poquito sobre lo que es el tema en general, porque fue mucha información. Aquí con nosotros, este es un foro de salud sobre servicios de proveedores de salud. Y a los presentadores que tenemos es Dr. James Cruz, es director médico de Blue Shield de California, Promise Health Plan. Tenemos a la doctora Diane Shawn. Ella también es directora médica de Molina Healthcare. Tenemos la directora Monique Knight. Ella viene por parte de United Healthcare. También nos acompaña Herminia Ledesma, es el manager de los programas de salud en la Vista Community Clinic. Con nosotros también nos acompañan Jorge Gómez y Lupita Hernández. Ambos son especialistas en lo que sería True Care, o antes se llamaba North County Health Services. So, ellos nos están acompañando por esta ocasión, y para los que nos están escuchando en español, si tienen preguntas para ellos, ahorita es el momento. Lo que quiero hacer ahorita es compartir lo que es mi pantalla. Alina, ¿podrías hacerme coach host para compartir lo que es Creo que hay algo aquí. Let me see. No sé si puedan ver o creo que no puedo compartir mi screen. Rayos. Lo siento, es un problema.
Ana, no
técnicos de
puedo.
aquí. Estoy tratando de compartir mi screen, pero no se puede. Quería decirles, bueno, les voy a decir. Cada uno de los proveedores que están aquí y todos los que dan algún tipo de servicio de salud, lo que sucede es que toda la información la ponen en su sitio web. Lo que tienen que hacer es, si no entienden la información, vayan al sitio web de cada una de las instituciones de salud y busquen en la parte de arriba la opción donde dice español. Todos van a tener una opción que dice español. Es muy importante que entiendan los servicios que las personas ofrecen sobre su salud. Ellos tienen toda esta información en su sitio web. Para Molina Healthcare, pueden visitar lo que es molinahealthcare.com. Para United Healthcare, pueden visitar uhc.com. Para Vista Community Clinic, pueden visitar vistacommunityclinic.org. Y para TrueCare, pueden visitar truecare.org. Y pues para Blue Shield, vayan a Blue Shields, CA de California.com. Todos los proveedores van a tener esta información en español. Fue mucha información que se cubrió. Si tienen preguntas ahorita mismo, háganlas ya porque se van a ir cada quien para su casa. Thanks everybody for joining. If you have any last minute questions, please put them in the chat and the health providers are here to respond them right now. Also, if, let me see. If there's anything else that anybody wants to share, final thoughts?
Yeah, Ana, is it okay if I share something really brief? And I can do it in Spanish and English.
Okay, go ahead.
One thing, thank you, Ana, for sharing our contact information. And one of the things that we also want to urge you on is, aside from our website, you can also find live data on our social media. So we know that sometimes a website, you're already on social media and going onto a website might be going a little bit out of the way, but we're actually, I think, all probably connected to social media, and a lot of live information is posted there. So VCC, Vista Community Clinic, posts information about flu clinics, and we actually have one going on today from 9 a.m. to 2 p.m. It's a drive-through flu clinic for community members, and folks can walk up to. We do ask everyone to adhere to all the safety guidelines. So please also reach out and connect with us that way. And I'm going to repeat the message in Spanish. Gracias, Ana, por compartir toda esta información. Sé que fue mucha información, y gracias por dar el contacto de nuestras páginas y sitio web. Para muchas de las agencias aquí, incluyendo nuestra clínica de vista, estamos también usando los medios sociales, las redes sociales bastante para proveer la información en tiempo real a las comunidades. Nosotros podemos poner información sobre eventos que tenemos. De hecho, la clínica tiene un evento para proveer vacunas para la flu de 9 a.m. hasta las 2 de la tarde. Pueden ser por carro o también si las personas llegan caminando. Nada más les pedimos que mantengan su distancia y sigan todo el reglamento de seguridad. Y les aconsejamos que se conecten con nosotros por las redes y se mantengan en contacto. Gracias.
Anybody else wants to share some final thoughts for the community?
Yes, I would just like to say that right now, it's especially important that people continue to visit their doctors for their routine health exams, for their vaccinations, routine monitoring of any health conditions that you might have. Although COVID is in full swing right now, it's still very important that you stay connected with your healthcare provider. So all of our healthcare providers are taking precautions to keep you safe in their offices. But if you're more comfortable Ask your healthcare provider if they offer telemedicine as an option. That's a really great way for you to see your provider without having to go out into public. So just consider that as an option, but it is important. Don't stop seeing your doctor because of COVID. It's important that you continue to take care of your health now more than ever.
I guess I have one final question for you all. Well, it's more like anybody from the community. I mean, not everybody is part of like each one of your services, but you provide services for everybody. Like, for example, when you have giving, I don't know, some resources away or free shots or sometimes food or protective equipment, all these kind of things. Do people have to be part of your institution in order to receive sometimes some of these services? Like free little things here and there or information, or if you have workshops, because I know like some of you might have some information sessions at some points. Do they have to be part of your health institution to just join and hear about it?
We have members advisory committees. We actually invite members in when we were not, socially distancing, and we'll have to host them virtual like you have here. So this is amazing what you guys are doing and streaming on Facebook. I know in the audience are some members from our crew who'll probably take this and do the same for us, for our members. But we would welcome, our members participating in, our community education events. And it is open to those, and I'm always, like I mentioned today, educating and just like you invited us. So if you have a group and you want us to present to your group, please reach out to us, and we have community services where we'll of course, like you did, and contribute. So thank you for inviting us.
Thank you, Diane.
Yeah, and Alina, like what Dr. Chow just said, I know this it's the same for a lot of health plans, that a lot of our publicly sponsored events, that we mentioned, like the food, events and the school supplies and some of the other community forums. Those are free to the public, so you don't have to be a member of Promise Health Plan to receive, if you're in part of the food giveaway or school supplies. Those, on the other hand, there are some things that might be specific to a doctor's office or a clinic that we sponsor, and that might be focused primarily on Promise Health Plan members, but because we have to work with the clinic, and so, but for the majority of our publicly sponsored events, it's free to the public. You don't have to be a member of Promise Health Plan to participate or to receive any of the items that might be provided.
Yes, and I think that's true for United Healthcare as well. There are some benefits, well, a lot of things that we do in the community, again, like the food distributions or the free community baby showers, the health education classes, those are open to the entire community, but there are certain benefits that are reserved for members only. So for instance, when I mentioned the free transportation, we do offer an unlimited number of rides, but that is specific to our members, as it is with all of the other health plans. So it just depends on the program.
For True Care as well, our food distributions are open to anyone in the public. If you, so all we do ask for is your initials and how many people live in your household, and that's all we ask for. You don't even have to show us ID. It's open to the public, but then again, going back to transportation, you do have to have an appointment with us. It does have to be with one of our patients, but most everything that's out in the public, we do partner with other nonprofit organizations. We do some fairs, some career fairs as well. That's all open to the public. It just really depends on what services you are looking at.
Okay. Thanks a lot for that, Jorge, and everybody else. Para los que hablan en español y que están escuchando esto, solamente les voy a repetir poquito lo que dijeron. Pueden ir a los sitios web de cada organización, pero también pueden ir a lo que es las plataformas en social media, Facebook, Instagram. Todas las organizaciones están en las redes sociales también. Entonces vayan pónganle like a todas sus páginas porque todos ofrecen cosas distintas. A veces tienen eventos comunitarios en los que dan servicios, información gratis o servicios gratis, o como en ocasiones hay organizaciones que están dando lo que es comida o servicios de protección o diapers para los bebés. Es diferentes cosas que cada una de las organizaciones está haciendo para la comunidad y usted tiene que estar informado de esto. Lo están poniendo en social media constantemente, así es que siga a diferentes servicios de salud porque cada quien está haciendo cosas diferentes y cada uno de esos servicios se beneficiará usted. Además recuerde de asistir a otros talleres sobre salud para informarse más sobre la situación. Y hágales preguntas, contáctelos. Sus números de teléfonos están en los sitios web. So all phone numbers are on their websites. All phone numbers are also in social media. You can contact them, text message them, or through, I don't know, Messenger, Facebook, Instagram, whatever. They probably are there too. So if you have information or need more information about something, just research it on their website and find their contact information there or social media. Thanks. I'm returning control to Alina. And thank you everybody who came here at this event. Dr. Diane Chao, Jorge Gomez, Herminia Ledesma, Lupita Hernandez, Dr. Jaime Cruz, and Monique Knight. Thank you everybody. Alina, now it's your turn.
Yes, thank you one last time for joining us this weekend and giving us wonderful information. I do hope that our viewers reach out to you guys because you provided so much for our community. We are now going to continue with our program. Let me share my screen. This is another message for all of our viewers to make sure that you go out and vote in November. You should be receiving your ballot in the mail, so make sure that you keep an eye out for that and make sure that you take your part in voting. We have COVID-19 virtual community education session that is on Tuesday, October 27th from 5 to 6 p.m. The registration is open for this session, so you can learn what each of our resource centers offer and how to get assistance during the pandemic. Barbara Jimenez, the Director of Central and South Regions of the County of San Diego Health and Human Services Agency, will join the session as a guest speaker.
Alina, I'm going to present Oscar Gomez. So we have here Oscar Gomez. He is with the San Diego Latino Health Coalition and also part with MAC, and they are working together. And he's going to present some information regarding COVID-19 and how to protect yourselves.
Hi, thank you. Thank you for having me on. And I just want to say I tuned into the last session, and there's something that I've learned in the last couple of months is that San Diego is well connected. We partner well together. You know, I'm looking at United Healthcare, Molina, Hermina Ledesma, with Vista Community Clinic, and now True Care. We all work together for the benefit of the community. And in that spirit, the county of San Diego had recognized that COVID-19 is disproportionately affecting the Latino community, as I'm sure the last panelist had just talked about. And in that effort, they got together an opportunity for organizations to work together to try to decrease the infection rates of Latinos with COVID-19. The coalition that we got together is called the San Diego Latino Health Coalition. It is led by our lead partner, the Chicano Federation, with MAC, San Ysidro Health, and South Bay Community Services being part of the lead teams. One of the things that we are doing for this initiative is to host community education sessions like the ones you see here on the screen. We did one last month in October where San Ysidro Health talked about COVID-19, talked about contact tracing, talked about the importance of making sure that everyone has a medical home. And one thing we learned through that session is that a lot of families wanted to know more about what resources were available across the county. So the sessions that you see here for 20 October and 27 October, it's going to be, the coalition's going to get together to talk about the different resource centers that we have as part of this, and to talk about what resources that each of us are offering. And then we have Barbara Jimenez, who's going to talk about what resources the county has. So there's a lot of information that's out there about resources for COVID-19, and this is a way to tune in to hear from Chicano Federation, from MAC, South Bay Community Services, San Ysidro Healthcare, and then also their partnering organizations on the work that is being done in San Diego County. So we encourage families to tune in, but we also want to make sure that if you are a social service organization who serves the Latino community, that you join in as well, so you can hear about the resources that are available. And then one thing that we're really excited about that we're going to be getting out at all the resource centers are these COVID-19 kits. And the kits will include resource information about resources, but they'll also have thermometers. They're going to have disinfecting wipes, some disinfectant, and then also masks. So we'll be handing those out at our resource centers and also at different community events. So that's all the information that I wanted to come in today to share about, to invite everyone to follow us on Facebook. The San Diego Latino Health Coalition has a Facebook page, but then also to register for the community education sessions that we have coming up this month. So I don't know if we can take questions about the coalition, but I was just wanting to come in, and I want to thank you for having me on to talk about these sessions.
Yes, thank you. I do not believe we have any questions from our viewers, but let me double check. No, we have no questions for you.
Okay.
Thank you for joining us.
Absolutely.
Yes, thank you. Okay. This is our featured book this week. So, A Sympathy of Rivals, A Song in My Heart, by Roma Galatuid Stocks. Award-winning author, the narratives set in locations across the world provide a window to the artistic contributions of diverse cultures.
Picture books, A Symphony of Rivals, and A Song in My Heart by Roma Calatayud-Stocks, award-winning author. The narratives, set in locations across the world, provide a window to the artistic contributions of diverse cultures while addressing poignant issues, politics of the era, and history. Award-winning books in the International Latino Book Awards, Midwest Book Awards, and Multimedia Experiences by Mom's Choice Awards and Mariposa Awards. It all starts with music and a great story. romastocks.com.
We want to take this moment again to make sure that you guys are following us on Facebook at LBFFS. And That's where you've been able to catch us for Facebook Live. You can also check out our website, www.lbff.us. If you have liked these panels that we've been able to provide, if you've liked all the information that's been shared during this virtual Latino Book and Family Festival, and you have the means to, please go to www.lbff.us to make a donation so that we can continue hosting these wonderful weekly events for you all. We would like to take a moment to thank our sponsors for this event, AARP, Miracosta College, Telemundo 20, and San Diego 7, MAC, and Route 78 Rotary. We would also like to thank our literacy sponsors, Raymond James Loyola Press, the International Latino Book Awards, San Diego County Library, Isla, Student Equity, Naleo, and Education Begins in the Home. This was the 68th Latino Book and Family Festival. Esperamos seguir proveyendo un espacio educativo para las comunidades. Once again, a good thank you to our partners.